Bine v-am regăsit, doamnelor, domnilor, aici, la Sănătatea fără frontiere. Astăzi, alături de mine, prin intermediul StreamYard, așa cum v-am obișnuit, un alt medic de top din Turcia. Vorbim astăzi despre transplantul de ficat. Alături de mine este profesorul dr. Deniz Balci. Hello, doctor. Nice to hear you. Nice to talk to you. How are you?
Thank you so much, and thanks for having me with you today.
It's our pleasure. Doctor, as I said, you are a surgeon. You take care of what a liver transplantation means. And I want to know, first of all, Dr. Balci, what is liver transplantation and how is it done?
Liver transplantation is a relatively newer method of advanced liver surgery. It involves, it has been done in end-stage liver disease, and it is a permanent solution for patients with cirrhosis and end-stage liver disease. This involves removal of the diseased liver, the cirrhotic liver, and putting in a whole or partial new liver that will take care of the body's needs after the operation. So it is being executed for patients with chronic liver disease, cirrhotic patients, and now relatively in the last 10 years for cancers involving the liver.
Okay, doctor, please tell me, what can you say about the liver transplantations with a living donor?
Well, the liver transplantation requires a liver graft that is coming from a source. This source can be donated organs, and this source can be living donors. In countries where deceased donors are available and deceased organ donation rates are high, or let's say is enough for the patients within the country, there is relatively less need for living donor liver transplantation. For instance, in Turkey, we have a very low deceased donation rate, which is around 6-7 per million population. And this requires us to perform living donor liver transplant operations for patients with cirrhosis and liver cancers. According to our legislation, up to 4th-degree relatives of the patient, which could be translated into the cousins and nephews of the patient, can donate part of their liver to their relatives. And at the same time, if the patients are beyond the 4th-degree relativity, this can still be done under the allowance and guidance of Central Ethical Committee in Turkey. So the living donor liver transplantation is the mainstay of patients in Turkey with end-stage liver disease, liver cirrhosis, and liver cancers.
Please tell me, Dr. Deniz Balci, if the liver transplantation can be applied to babies.
Yes, it can be applied to adult patients, generally for adult patients, hepatitis B, hepatitis C, and recently the non-alcoholic steatohepatitis, that's what we call is NASH cirrhosis, is part of global pandemics of obesity, has been the main reasons for adult patients with end-stage liver disease. And another indication will be liver cancers, whether they are from liver cells or bile duct cells. For pediatric cases, we are performing living donor liver transplantations, starting from neonatal months, that is probably after the 1st and 2nd month partial living donor liver transplantation can be performed. In this setting, this requires a very small part of liver that comes from the relatives of the patient. Usually, this is mother or father of the patient, and this liver has been. There are special techniques that we are using under 3D reconstruction of computer software simulation, that we procure the exact required and the size matched graft from the donor, and transplant this small part into the baby, and then close the abdominal cavity for the fast recovery of the pediatric patients. In babies, generally, the main reason is insufficient development of bile ducts that present with jaundice. These small babies develop jaundice in the early times of their life, and they are diagnosed. And other common indications are genetic and endocrine disorders that results with liver insufficiency or liver cirrhosis.
That's what I wanted to find out from you, Dr. Balci. What are the causes of liver problems when we talk about babies?
The main problems, as I mentioned, is the number one disease is biliary atresia. Biliary atresia is synonym with it means that the bile ducts of the liver in the liver of the baby did not develop well, and these babies are born with some or develop jaundice in the early stage of their life, and generally they are required to do a bile duct operation to open the channels for the bile can flow into the intestine. But most often this is not enough. This is not an enough solution, and these babies develop liver cirrhosis around the first couple of years of their life, which ultimately require living donor liver transplantation or deceased donor liver transplantation. While liver transplantation is a cure for these babies, which they go into their normal lives, go to the school, and they become adults completely healthy, this solution can be either from the deceased donors, as I mentioned, or living donors. In the living donor liver transplantation setting, this requires very sophisticated techniques to perform these operations in experienced centers.
I understand. Please tell me, doctor, is transplantation possible in liver and bile duct cancers?
Yes, liver transplantation is possible in both of these cancers. The liver cancer and bile duct cancers are two different types of cancers. They arise from different cells within the liver, and they have different clinical progression or natural history, as we say. The liver cancers in the early stages, the best treatment is liver transplantation. Now, for later stages, there are treatment alternatives of embolization and local therapies, and sometimes surgery. We perform surgery to take out the cancers and clean the liver. But when this develops in the diseased liver, in the cirrhotic liver setting, generally they have a tendency to recur. And liver transplantation is a very good treatment, actually the golden standard treatment for long-term survival of these patients for liver cancers. This is called hepatocellular carcinoma. The second one, the bile duct cancers, is called cholangiocellular carcinoma or Klatskin tumors if they are located in the bile duct bifurcation. Those bile duct cancers arise from the biliary tree that start from the small parts of the liver and become the main trunk that drains the bile to the intestines from the liver. And these bile duct cancers, in the very early stage and selected patients, liver transplantation is a curative treatment option. But in general, bile duct cancers should be treated with advanced aggressive surgeries. Surgery is the mainstay treatment for these cancers, and probably these are the most complicated cancers that require advanced surgery, bile duct cancers. When they are located in the bile duct bifurcation, they are mostly involved with the vessels that are the arteries and the veins that brings blood to the liver. So the experience of the team will be determining the results of these aggressive surgeries that are needed. A multidisciplinary team is very important to plan these operations and follow these patients postoperatively. So if we want to sum up, liver transplantation can be performed for both primary liver cancers that are liver cancer, hepatocellular cancer, and cholangiocellular cancer, and liver surgery is the golden standard treatment for these diseases.
Okay, I want to know, doctor, about the pancreas cancers. How are these pancreas cancers effectively treated?
Pancreas cancers, unfortunately, this is a rare but deadly disease. This is probably a lot more rarely seen comparing to breast cancer and colon cancer, but the 5-year survival, which is the outcome of the patient, is a lot worse than other cancers. With a cumulative 5-year survival of pancreas cancer is less than 20% in most settings. The only way to prolong the survival of patients with pancreas cancer is early diagnosis, and this early diagnosis is frequently combined with a successful pancreas cancer surgery can provide good term outcomes. In the recent developments in the pancreas cancer has made it available, the surgical treatment has become available for local advanced disease that involve the vessels of pancreas. Those are the superior mesenteric veins and arteries that the tumor most often involves and require resection and reconstruction in a difficult and complex pancreas surgery. This kind of surgical operations has been successfully performed in experienced centers like liver transplantation and will determine the outcome of the patient. And of course, in every cancer treatment, I would like to mention that the multidisciplinary planning of the treatment procedure and multidisciplinary follow-up of the patient is extremely important.
And my last question for you, Dr. Deniz Balci, because I know you are getting ready for an important surgery, is what are the chances when we are talking about an organ transplant for a patient? What are the chances for a normal life, let's say?
Well, organ transplantation, speaking of liver transplantation, mostly this applies to kidney transplantation as well. The 5-year survival of organ transplantation is beyond 70%. So nowadays we can say we can perform organ transplantations, liver transplantation and kidney transplantation relatively very successfully in experienced centers. And those patients could expect a normal life expectancy generally after the first 3 months and then after the first year has been managed. Those time points are critical, especially in the first month and the 3 months is the surgical problems that happen. And after that, in 1 year, generally immunological and infectious problems are potential problems after organ transplantation. Once these are maintained and the patients pass past these time points, they are expected to live a very normal life. They go back to their working life, their family life. The children can go to school and they are expected to have a normal schooling. Adults can have marriage, have children, and mostly that these operations has been done for elderly people. They have satisfactory 5-year, nowadays 10-year survival rates after organ transplantation. The important and critical part is having an available organ to transplant these patients. The organ shortage is the main limitations for these patients.
Thank you very much, Doctor, for all this precious information you offered us today. Have a nice day and good luck.
Thank you. Thank you again for having me, and thank you for the opportunity to talk. Thank you.
It was our pleasure. Thank you very much again. A fost așadar, doamnelor, domnilor, profesorul dr. Deniz Balci. Am vorbit despre ceea ce înseamnă transplantul de ficat. Domnul dr. Deniz Balci este unul dintre medicii de top de acolo din Turcia atunci când vorbim despre ceea ce înseamnă efectuarea transplantului de organe, în special transplantul de ficat, așa cum am vorbit în această seară. Până data viitoare la o altă întâlnire cu un alt medic de top de acolo din Turcia, eu vă doresc toate cele bune. La revedere!